What's going on, guys? Coco Mama Niger Gist channel right here. Now, before we dive into today's video, don't forget to follow our Facebook channel for weekly giveaways and exclusive updates, and also make sure to subscribe to our YouTube channel for a chance to win in our monthly giveaways. You know what I'm saying? Stay connected and win amazing prizes while keeping you up with important stories. Now, in today's video, it's quite challenging and medical. We're covering a deeply alarming event, the kidnapping of over 20 medical and dental students in Benue State, Nigeria. All of these are just tragic. It's tragic. 20 medical students. Coming from Department of, how will I put this? Medical students on site using 7 years and some other things. It is not easy. You can just imagine that some people might be in their final year, or some of them might just be starting. Even if it's to kidnap, it's never right to kidnap anyone at all. But I'm just trying to express how it is. Like, bro, 7 years, medical students being kidnapped. Let's just hope all things go well. These students are part of the Federation of Catholic Medical and Dental Students, the FECANS. And they said they were ambushed while on their way to a community outreach program. Why would you ambush like these herdsmen or gunmen? Why can't they just? And I believe the government can try to do something about this kidnap and stuff. It's just to create a tight security around. But at the same time, I wonder what could have gone wrong if they were going for a community outreach program, and maybe knowing fully well of the surrounding an area, they were not security tight enough, and for them it was a mission of goodwill that turned into a nightmare. Now, the students, along with a house officer, were on a journey to provide essential healthcare service to a rural community when they were suddenly abducted by gunmen. This tragic event has left families in despair and highlighted the severe security challenges facing Nigeria. The kidnapping is a grim reminder of the growing threat that banditry and violence pose to the safety of citizens across Nigeria. Now, this attack, particularly on those indicated to helping others, underscores the urgent need for improved security measures. That's exactly what I was talking about. The security measures, the improvement in everything. Now, in this Benue State, it has been quite a number, or highly substantial number, of these kidnaps. Benue State has been increasingly plagued by violence, especially from armed robbers and headsmen and bandits and the likes. Now, this state's economy, largely based on agriculture, has suffered as farmlands are abandoned due to these attacks. You can imagine that people, family, maybe their source of income is rearing of animals and growing of crops and the likes on their own farmlands, but because of this stubborn violence and kidnapping sort of thing, they are not able to continue. They're not able to fend again, and so the places are left abandoned. It's terrifying. It's a nightmare. It's bad. It's very bad. Families are supposed to be eating and caring for themselves, but yet they are scared to go out. Our security measures has to be very, very tight. The government has to improve on security measures. It needs to be over 100%. Now, it seems like this kidnapping of these medical students, it has been the latest of the series of violent incidents that have terrorized the local communities and disrupted their daily lives. Now, the rise in these attacks, it has led to widespread fear and instability, like I said earlier, making it clear that the current security measures are insufficient. Exactly. They are very little. They are insufficient. For someone with someone quite sensible, when something should happen the first time or second time, you know that the third time you should pick up that no, this is not going to be happening again. If they have been kidnapping people for a long time, I mean, the security measures supposed to have been improved. Yeah, I understand that human beings are also the ones, protecting lives. But I mean, there's a reason why you are there for a purpose, to protect the citizens, and you should carry out that task. And now the people of Benue are calling for stronger government action to protect them and restore peace to their communities. Now, in response to the kidnapping, both the state and federal governments are vowed to intensify security operations in Benue. I'm pretty much aware that maybe that what they'll be telling them since. That's what Nigerians are used for. We will do this, we will do that. When everything subsides again and it happens again, they'll keep saying we'll do this and we'll do that. Now, security agencies have been deployed to track down the kidnappers and rescue the students, but many are skeptical about the effectiveness of these efforts, given that the governments have this particular track record. And by track record, I mean their how will I put it, their feedback, their statistics maybe have been very, very poor. People are maybe lost interest and everything. I mean, 20 medical students. I mean, that's, in fact, maybe there may even be something behind that. I mean, what could they possibly want? Like, that's absurd. Now, for the past events, that has been shown that while promises were made by the government, the outcomes often fell short. Now, this has led to public frustration and demands for more decisive and effectiveness and actions from the authorities. Now, the very abduction of these medical students, it has really sent shockwaves through the Nigerian healthcare sector. I mean, these students, they have been represented as the future leaders of the healthcare in the country, and their kidnapping could have far-reaching consequences. They could have far-reaching consequences. Now, the outreach programs, which they are vital for providing medical services to underserved communities, may become less frequent if the safety of medical personnel cannot be assured. Can you imagine now? Those that they want to help now, they will not be able to help them because of their kidnapping those that want to help them. Can you imagine? Can you just imagine? I think there should be something behind that. There should be something behind that. Maybe they don't want people, medical practitioners, to be helping them anymore. I mean, but that's bad. Can you imagine? In those local communities where they cannot save themselves, now we want to ensure people are getting tested, treated, and all those things, and now you are kidnapping them. That is, in fact, government is supposed to do something about it immediately. Something needs to be done. Now, the incident is likely to have a chilling effect on the morale of medical students and professionals across Nigeria. It raises serious concerns about the safety of those in the medical field, particularly when they are working in vulnerable areas. Exactly. People don't want to go, this area, this to kidnap people, this area, this to kidnap people, and now people will not be able to, assist, offer help, pass down knowledge to other people, or to help our patients or clients. Now, this tragic incident calls for urgent action. Yes, it's time for the government to prioritize the safety of its citizens, especially those who are dedicating their lives to helping others. We must advocate for stronger security measures, not only in Benue but across the whole Nigeria. Please, guys, I would like you to stay informed and support the efforts to bring these students home safely. Don't forget to share this video and raise awareness and help make a difference. Together, we can push for the change that Nigeria desperately needs. And that's for that. We just hope that our forces, our security tight officers, will find something to do about it. The government will find something deep to do to go about this. Now, this is another major breakout. I remember the last time when it was under Ebola time, coronavirus. I mean, oh God, those were days. And now it's been said that about 39 Nigerians have been suspected to have the Mpox, which is also known as the the monkeypox. Yes, the monkeypox. Now, today we'll be focusing on a very, very important health issue that has been affecting many parts of the world, including Nigeria, like I said. Now, it is the Mpox outbreak. Now, formerly known as monkeypox. Now, this disease has become a cause for concern, especially with the rising number of cases. Now, let's discuss what really this Mpox is about. Now, Mpox seems like a viral disease similar to smallpox but less severe. The virus was first discovered in monkeys 1958, and the symptoms seems to be fever, severe headaches, muscle aches, and exhaustion. Yeah, exhaustion. And do you know that this monkeypox? I didn't really even hear of it before, but it has actually come to Nigeria as at 2017. I mean, that's like 7 years ago. But that's 7 years now. If you start, it can be like like 2 months old or 7 months old, because everything seems to be going quite fast. And in 2017, after nearly 40 years with no reported cases, Nigeria saw a resurgence of Mpox with over 200 confirmed cases. Now, Mpox is not just a rural disease. Recent cases have been reported in urban areas across Nigeria, making it a nationwide concern. And as we know, it is majorly based in West and Central Africa. Given Nigeria's history with Mpox and the recent global spread, there is a real risk of outbreak occurring, especially in areas where healthcare access is limited. That should bring us back to that kidnapping now. You can imagine if Mpox is around that area and now they are kidnapping people, no security tight measures are being taken. Can you imagine? Look at the way the news are coming in side by side, one needing the other. May God help us. This should not be like this coronavirus Mpox time. Please, I beg you, God. This should not be like that time. Let's just I'm just assuring that you guys will be up to the task. Keep your surroundings clean. Your hygiene should be top notch. It should be top notch. Now, the ongoing practices of hunting and consuming bushmeat, popular food source in many parts of the country, can increase the risk of exposure. Exactly. Moreover, the movement of people across regions and borders heightens the possibility of spreading the virus. I beg. More now, protect yourselves. Nigerians, please protect yourselves by avoiding contacts with infected animals and people. It is also crucial to practice good hygiene, like I said. Wash your hands, be cool. All you dirty people, wash your hands, and regularly wash it with soap and water. Mpox is a disease that we as Nigerians should take seriously. We should take this one seriously. While it may not be as deadly as smallpox or coronavirus, but its impact can be significant, especially in communities with limited healthcare. Please, now let's stay informed. Let's follow the preventive measures and work together to prevent the spread of the Mpox in our country. Now, I'm pretty sure if you found this video insightful, please don't forget to like, share, subscribe, and hit that notification bell to always know what's up. Thanks for watching, and thank you.
Yeah.